Did you know your kidneys can lose up to 80% of their function without you feeling any pain at all? They are silent workers, but when they finally scream, it's usually an emergency. Today, I'm going to show you the one loud sign that demands an immediate hospital visit. The 10 subtle signals your body is using to beg for help. And, most importantly, 8 so-called healthy foods that could be damaging your kidneys right now. Stay with me, because what you don't feel might be what puts you at the greatest risk. Your kidneys don't scream. They don't send bright alarms. They're quiet, efficient workers tucked deep in your back, and most people don't notice trouble until a lot of function is already lost. In fact, kidneys can lose roughly 60 to 80% of their function before obvious symptoms show up. That's why I want to walk you through one unmistakable loud sign that demands immediate attention. Then 10 quieter signals your body gives when the kidneys are struggling. And, because the title promised it, I'll also cover 8 healthy foods that can stress kidneys in certain situations. By the end, you'll know what signs to watch for, which tests to ask your clinician for, and practical steps you can take now to protect your kidneys. If you want short, practical medical breakdowns like this, hit subscribe and stay with me. Imagine waking in the middle of the night with a pain that feels like a fist pressing hard into your side, then rolling waves of pain that move toward your groin. You can't get comfortable. Nausea and sweating come with it. That's the loud sign. Severe flank or kidney pain, and it deserves immediate attention. There are 3 main causes to keep in mind. First, kidney stones. These are hard mineral deposits that can form in the kidney and then travel down the urinary tract. When a stone moves, it stretches and irritates the ureter, and that causes the classic colicky, wave-like pain. You may see blood in the urine and often feel nauseated. Fever usually isn't part of an uncomplicated stone. If fever appears, think infection on top of a blockage. Second, kidney infection, or pyelonephritis. This is not a simple bladder infection, it's deeper, often causing a dull, constant ache in the flank, high fever, chills, and a more systemic feeling of being very unwell. If you have fever plus back or flank pain, that's a red flag that requires prompt medical care. Third, conditions like polycystic kidney disease can cause a chronic sense of pressure, fullness, or intermittent pain as cysts grow or leak or become infected. That condition often runs in families and commonly coexists with high blood pressure. What to watch for right now? If your pain is severe and unrelenting, if you have fever with back pain, if you can't urinate, or if you have heavy bleeding or signs of sepsis, rapid heartbeat, lightheadedness, high fever, seek emergency care immediately. Those are medical emergencies. For non-emergent but painful episodes, urgent evaluation and imaging may be needed to identify stones or infection. Now, let's move into the quieter territory. 10 silent signs that kidney trouble can give you long before an emergency appears. I'll name each sign, explain briefly why it happens, and tell you what to look for and what tests to consider. 1. Fatigue and brain fog. Many people describe vague, low energy, and trouble concentrating. When kidneys aren't clearing metabolic waste efficiently, small molecules that are normally removed, urea and other toxins, can build up and subtly affect mental clarity and stamina. Anemia from reduced erythropoietin production can add to tiredness. If you notice new, persistent fatigue that can't be explained by sleep, stress, or depression, mention it to your clinician and ask about basic labs. A complete metabolic panel, including serum creatinine and BUN, a hemoglobin, hematocrit, and a urine test. 2. Morning puffiness around the eyes. Waking with a puffy face, especially when it's most noticeable in the mornings, can reflect fluid shifting out of the blood vessels into tissues because protein, especially albumin, is lost in the urine. Albumin helps keep fluid inside your blood vessels. Losing it lets fluid leak into tissues. If you're seeing persistent facial swelling, ask for a urine albumin to creatinine ratio and a spot urine test. A single puffiness episode isn't diagnostic, but persistent morning swelling deserves evaluation. 3. Swelling in the legs and ankles. Peripheral edema, swelling in the lower legs and around the ankles, often gets dismissed as standing too long or getting older. But when kidneys lose the ability to regulate sodium in water, fluid accumulates. Evening swelling that worsens by nightfall, or swelling that comes on with increasing shortness of breath, should be evaluated. It's especially important if it's asymmetric, painful, or accompanied by breathlessness. Tests include serum creatinine and an assessment of fluid status. Your clinician may also look at albumin levels and heart function to determine causes. 4. Changes in urination. Kidneys regulate urine volume and concentration. You might notice urinating more often at night, nocturia, or a reduction in urine output, or that urine looks darker or more concentrated than usual. Strong or unusual urine odor can also be a subtle sign. None of these by itself confirms kidney disease, but persistent changes, especially decreased volume or dark-colored urine, should prompt testing. A basic urine dipstick, a urine albumin to creatinine ratio, and a serum creatinine level are reasonable next steps. 5. Persistent foamy urine. A single ripple of foam after a hard stream isn't necessarily alarming, but persistent foamy urine that keeps returning can be a sign of proteinuria, protein leaking into the urine. Proteinuria, particularly albuminuria, is an early signal of glomerular damage. Clinically, we use the urine albumin to creatinine ratio, ACR, to quantify this. Roughly speaking, an ACR under about 30 mg/g is considered within expected limits. An ACR between 30 and 300 mg is often called microalbuminuria, and values above 300 mg suggest more significant, or macroalbuminuria. Those numbers are approximate and must be interpreted in context. Discuss them with your clinician. Persistent foam should not be ignored. 6. Itchy, dry skin. As kidney function declines, waste products and mineral imbalances can accumulate and alter skin health. Phosphate retention and other shifts can make the skin feel dry, and chronic itching without a clear dermatologic cause may sometimes be related to reduced kidney function. It often appears later in the spectrum, but if you're seeing persistent unexplained itching accompanied by other signs, bring it up. 7. Symptoms of anemia. Cold intolerance, pallor, shortness of breath with exertion. Diseased kidneys make less erythropoietin, a hormone that stimulates red blood cell production. When that falls, hemoglobin can drop, and you'll feel colder, paler, more easily winded, and more fatigued. If simple tasks leave you breathless compared with before, a hemoglobin check and evaluation for kidney function are reasonable. 8. High blood pressure that's hard to control. Kidneys and blood pressure have a close two-way relationship. Elevated blood pressure is one of the leading causes of chronic kidney disease, and damaged kidneys can in turn worsen blood pressure control. If you have hypertension that seems unusually resistant to multiple medications, or you've developed new hypertension without clear cause, consider asking your clinician whether kidney function has been assessed. Control of blood pressure is one of the most powerful ways to slow kidney damage, so this one matters. 9. A persistent metallic or ammonia-like taste in the mouth, or halitosis. When nitrogenous wastes, such as urea, build up, some of it can be converted by oral bacteria into ammonia. producing an unpleasant metallic or ammonia-like taste or breath. If your food suddenly tastes unusual, or you can't get rid of a bad taste, that's a cue to check kidney-related labs in the right context. 10. Poor sleep and restless legs. Sleep problems in kidney disease can come from many sources: metabolic imbalance, restless legs from disturbed electrolyte handling, or the discomfort of other symptoms. People often report trouble falling asleep, waking frequently at night, or persistent, twitchy, restless sensations in the legs. If sleep problems are new and don't respond to usual sleep hygiene measures, consider a kidney check as part of a broader evaluation. Remember the refrain: kidneys don't cry out, your body does. Any combination of these quieter signs, especially if they persist or worsen, is a reason to seek testing. Which tests should you ask for? A few targeted labs will give your clinician a much clearer picture. First, serum creatinine and an estimated glomerular filtration rate, or eGFR. Creatinine is a waste product from muscle metabolism. eGFR is a calculated estimate of how well your kidneys are filtering based on creatinine, age, sex, and sometimes race, though many labs and clinicians are moving away from race-based adjustments. eGFR is commonly interpreted like this: values above about 90 milliliters per minute per 1.73 meters squared are generally considered normal. 60 to 89 may be slightly reduced, but can be normal depending on age and context. A persistent eGFR below about 60 suggests chronic kidney disease if it persists for 3 months or more. Very low values, for example in the teens or below 15, can indicate severe loss of kidney function. These are approximate thresholds. Discuss your individual numbers with your clinician. Second, urine albumin to creatinine ratio, ACR. This spot urine test detects protein leakage that often precedes changes in eGFR. As I mentioned earlier, an ACR under about 30 mmHg is generally expected. 3,300 mmHg suggests increased albumin loss, microalbuminuria, and values above that suggest more significant albuminuria. Because albuminuria is a marker of kidney and cardiovascular risk, it's worth checking, especially in people with diabetes, hypertension, or cardiovascular disease. Third, blood urea nitrogen, BUN, a rough marker of nitrogenous waste, and basic electrolytes, sodium, potassium, bicarbonate, calcium, and phosphate. Potassium is important because the kidneys regulate it tightly. Notably, typical normal potassium ranges are about 3.5 to 5.0 milliequivalents per liter, so levels above that may require prompt attention. Phosphate commonly ranges roughly from 2.5 to 4.5 milligrams per deciliter in adults, but values vary with age and lab. These are ballpark figures to help you understand results, not substitutes for clinician interpretation. When should you get tested? If you have any of the signs we discussed, get tested now. If you have risk factors, diabetes, hypertension, cardiovascular disease, a family history of kidney disease, or are over 60, consider at least yearly screening with eGFR and a urine ACR. If results are abnormal, repeat testing and clinical correlation are important. Many things can transiently change these numbers, so confirmation and follow-up matter. Prevention and practical daily habits are where you can take meaningful action. Start with metabolic health, insulin resistance and high blood sugar damage, tiny blood vessels in the kidneys over time. Balanced nutrition, regular physical activity, and weight management are powerful tools to reduce insulin resistance. If you have diabetes, tighter glucose control reduces kidney risk. But discuss individualized targets with your clinician. Blood pressure control is essential. For most people with or at risk for kidney disease, lower blood pressure targets reduce progression risk. Exactly how low is right for you should be set by your clinician, but if you have resistant hypertension, blood pressure that doesn't respond well to treatment, a kidney evaluation is a priority. Hydration matters, but more isn't always better. Aim for consistent, moderate hydration. A practical rule of thumb is to monitor your urine color. Pale straw or light yellow generally indicates reasonable hydration. Dark yellow suggests you need more fluids. Don't force excessive water intake unless instructed by your clinician. People with advanced kidney disease or heart failure can be harmed by overhydration, so individualize fluid goals. Avoid frequent or unnecessary use of NSAIDs like ibuprofen and naproxen. These common pain relievers can reduce blood flow to the kidneys and, with chronic use or in vulnerable people, can worsen kidney function. Use them sparingly and discuss safer alternatives with your clinician, especially if you have risk factors or existing kidney disease. Be cautious with supplements and concentrated herbal extracts. Many natural products are unregulated in concentration and purity, and some herbs have been associated with kidney injury. High-dose vitamin C can convert to oxalate in the body, and in excess may increase the risk of kidney stones in susceptible people. If you're considering high-dose supplements or herbal cleanses, check with your clinician first. Protein intake should be sensible. For most healthy adults, normal dietary protein is fine. But if established kidney disease is present, many clinicians recommend moderating protein intake to reduce kidney workload. Again, personalized advice from a clinician or renal dietitian is essential. Don't rewrite prescriptions or stop medications on your own. Any changes must be supervised. Now, the title promised a list of 8 healthy foods that can be problematic for people with kidney concerns. I want to be crystal clear. For people with normal kidney function, most of these foods are fine in moderation. These cautions mainly apply to individuals with reduced kidney function, those on a potassium or phosphorus-restricted diet, or people prone to certain types of kidney stones. For each food, I'll explain why it's commonly seen as healthy, how it can be problematic, and practical guidance. 1. 1. Ketones, spinach. Why it's considered healthy. Spinach is nutrient-dense. It's full of vitamins, minerals, and antioxidants, and a staple in salads and smoothies. How it can be problematic. Raw and cooked spinach are high in oxalates, compounds that can combine with calcium to form calcium oxalate kidney stones in people prone to that stone type. Practical guidance. If you've had calcium oxalate stones or have been told you have high urinary oxalate, limit large, frequent servings of spinach and discuss alternatives like kale or arugula. Don't eliminate vegetables broadly. Variety matters. 2. Beetroot and concentrated cranberry juice. Why healthy? Beetroot has nitrates that may support blood flow and exercise performance. Cranberry is often used for urinary tract health. How problematic? Both beets and cranberries are relatively high in oxalate compared with some other fruits and vegetables, and concentrated juices deliver a big oxalate load in a small volume. Practical guidance: consume whole beets or cranberries in moderation and avoid large amounts of concentrated juice if you're prone to oxalate stones. If you rely on cranberry for recurrent UTIs, talk to your clinician about tailored strategies. 3. Bananas, avocados, potatoes, and other high-potassium, healthy foods. Why healthy? These foods are full of fiber, vitamins, and heart-healthy nutrients, and are staples in many balanced diets. How problematic? Potassium is tightly controlled by the kidneys. When kidney function falls, potassium can build up and reach levels that affect the heart's rhythm. People who are advised to follow a potassium-restricted diet, or who have persistently elevated potassium on labs, need to moderate these foods. Practical guidance: Don't panic eject potassium-rich foods if your kidneys are healthy. If you have reduced kidney function, ask your clinician to check your potassium and give individualized advice. Small portions and cooking methods, like boiling some vegetables and discarding the water, can reduce potassium content. 4. Nuts and seeds. Why healthy? Nuts and seeds are nutrient-dense, providing healthy fats, fiber, and plant protein. How problematic? They're also relatively high in phosphorus and, in some cases, potassium. In chronic kidney disease, phosphorus can accumulate when kidneys fail to excrete it, leading to bone and cardiovascular issues. Practical guidance. If you have early-stage kidney disease, moderate portions of nuts are often acceptable. If you're in later stages or your phosphorus is elevated, discuss portion sizes or substitutions with a renal dietitian. 5. Concentrated protein powders and high-protein meal replacements. Why healthy? Many people use these to support workouts or as convenient meal options. How problematic? Very high protein loads repeatedly can increase the kidney's filtration workload. In people with existing kidney impairment, excessive protein intake may accelerate progression. Also, some powders contain added phosphorus or potassium. Practical guidance. If you're healthy and active, moderate protein supplements are usually fine. If you have reduced kidney function, check with your clinician about appropriate protein targets and consider choosing products with lower phosphorus additives. 6. Healthy, processed, or convenience plant-based options and canned broths. Why healthy? Plant-based burgers, canned beans, seasoned broths, and other convenience items are often marketed as healthy or diet-friendly. How problematic? Many of these products are high in sodium, which can drive fluid retention and worsen blood pressure control, both harmful to kidneys. Canned vegetables and broths can be remarkably salty. Practical guidance. Read labels and choose low-sodium versions. Rinse canned beans and limit heavily salted convenience foods. A food that's plant-based isn't automatically kidney-friendly. 7. Green smoothies and juice cleanses. Why healthy? Blending greens into smoothies is trendy and a quick way to ingest vegetables. How problematic? When you concentrate a lot of leafy greens and fruits into one drink, you concentrate the oxalate and potassium load as well, and you may bypass the fiber-regulating effects of chewing whole foods. Practical guidance. Vary your greens. Avoid making massive daily smoothies full of spinach and high-potassium fruits if you have kidney issues, and consider whole food servings spread across the day instead. 8. Dairy and certain fortified plant milks. Why healthy? Dairy is a source of calcium and protein. Fortified plant milks are often presented as healthy alternatives. How problematic? Dairy products and some fortified foods contain phosphorus and potassium, and certain phosphate additives in processed foods are highly absorbable. For people with advanced kidney disease or elevated serum phosphate, dietary phosphorus can be important to control. Practical guidance. Keep dairy in moderation if you have reduced kidney function, and check labels for phosphate additives in processed or fortified foods. Work with a renal dietitian for individualized plans. Across every one of these items, the message is the same. Context matters. For most people with normal kidney function, these foods are nutritious and safe in moderation. The cautions are targeted toward those with reduced kidney function, prior kidney stones, or lab abnormalities that require dietary adjustments. If you have kidney disease, talk with your clinician or a renal dietitian before making sweeping dietary changes. Back to tests and interpretation. If you have abnormal findings, your clinician may order additional studies. Repeat urine tests, imaging like renal ultrasound if stones are suspected, or a referral to a nephrologist. Some people benefit from 24-hour urine collections to quantify stone risk or urinary excretion of oxalate, calcium, sodium, and protein. Again, these are tools to personalize care. Let's reinforce some actionable prevention steps you can adopt today. First, if you're at risk, for example, you have diabetes, hypertension, a family history of kidney disease, are over 60, or have had kidney stones, ask for an eGFR and urine albumin to creatinine ratio at least once a year. If your results are normal, repeat at a cadence your clinician recommends. If abnormal, follow up more frequently. Second, control blood sugar and blood pressure. Small lifestyle changes add up. A balanced diet with attention to whole foods, regular physical activity, reducing smoking, and limiting excess alcohol all help. Medication-based control for diabetes and hypertension is often necessary and effective. Don't stop or change medications without guidance. Third, hydrate sensibly. Aim for steady intake that keeps urine a pale straw color most of the day. Avoid extremes. Both chronic underhydration and forced overhydration can be harmful in certain contexts. Fourth, limit routine NSAID use and be cautious with over-the-counter combinations. If you need frequent pain control, talk to your clinician about kidney-safe alternatives. Fifth, avoid unnecessary concentrated supplements and herbal extracts. If you do use them, mention what you take at every medical visit. Some herbal kidney cleanses have been linked to kidney injury. Sixth, if tests show proteinuria, blood pressure targets and medications such as certain blood pressure modifying agents can reduce progression risk. But medication strategies must be individualized, and you should discuss them with your clinician. A short, practical checklist to take away. If you experience severe flank pain, fever with back pain, inability to urinate, or sudden heavy bleeding, seek emergency care immediately. If you notice persistent fatigue, new swelling around the face or ankles, persistent changes in urination, persistent foamy urine, unexplained itching, breathlessness with activity, rising or resistant blood pressure, persistent metallic taste, or new sleep disturbance with restless legs, mention them to your clinician and ask about eGFR, urine albumin to creatinine ratio, and basic electrolytes. If you have diabetes, hypertension, a family history of kidney disease, or prior stones, prioritize annual screening and early discussion. Before I close, a few common questions I hear often. 1. Can kidney disease be reversed? It depends on cause and stage. Some acute injuries can improve greatly with treatment. Chronic changes may be slowed or managed, but reversal is not guaranteed. The best approach is early detection and risk factor control. 2. Are all supplements dangerous? No, many supplements are safe, but some concentrated herbal extracts and high-dose vitamins can be risky. Always run supplements by your clinician. 3. If I have one abnormal lab, does that mean kidney disease? Not necessarily. Labs can be affected by dehydration, temporary illness, or lab variability. Abnormal results are usually repeated and interpreted in clinical context. One more time. Kidneys don't cry out. Your body does. Listen to the subtle signals and act earlier rather than later. If any of what we discussed today resonates, if you've noticed persistent swelling, foam in the toilet, a taste that won't go away, sleep trouble with restless legs, or unexplained fatigue, speak with your clinician and ask for eGFR and urine albumin to creatinine testing. If you have severe pain or fever with flank pain, get emergency care. If you found this helpful, download the one-page kidney checklist in the description. It summarizes the signs, the tests to request, and the simple daily habits to help protect your kidneys. Print it, bring it to your next appointment, and discuss any concerns with your clinician. You don't have to be a passive observer of your health. Small steps, early testing, and targeted changes can make a real difference. Take care of those quiet workers inside you. They're doing a lot for you every day.